Does ketamine therapy help with anxiety? I'm Dr. Suegee, the medical director at Liminal Medicine, and I get this question really often. So I reviewed the literature and I found a paper that I wanted to go over with you that kind of answers this question. So let's look at this paper from 2021 in the journal Therapeutic Advances in Psychopharmacology. This is a peer-reviewed journal. Um, and like the last article we looked at, this is another study that is a systematic review and meta-analysis of other published research studies. And once again, if we look at this particular type of research, we know that this type of research is at the top of the hierarchy of evidence. So you can think of these as studies of studies. And the attempt to combine many relevant studies that have been conducted on a research question and summarize their overall conclusions. So in this study, they reviewed 6 different studies, which covered research on social anxiety disorder, general anxiety disorder, post-traumatic stress disorder, and obsessive-compulsive disorder. Four of the six studies, four of the 6 studies reviewed showed significant improvement in anxiety rating scores in the patients who received ketamine as compared to the control group, which is a good sign. These preliminary analyses suggest that ketamine may be broadly effective across treatment-resistant anxiety disorders, a whole bunch of them, and these effects can be prolonged with maintenance treatment, which means some ongoing ketamine. The study also shows that the dose of ketamine made a big difference here. Specifically, higher doses were associated with greater improvement in anxiety ratings than lower doses. A similar dose response was described for ketamine's antidepressant effect, with higher doses showing better results than lower doses. One of the important things that the authors mention is that unlike the large amount of research that's available out there for treatment-resistant depression, there are not many studies on the use of ketamine for treatment-resistant anxiety. So hopefully we'll see more studies published on this issue in the coming years, but at this point, things are they're looking good. Now, once again, these are not great studies because there's not large numbers of people in them. But as we go forward, hopefully we'll see more research come up from this. Anyway, any questions? Go to our bio and click the link and sign on for our newsletter. And we hope to answer any of the questions you have coming up. Thank you. Bye-bye.